I am Dr. Bibek Shrestha, currently intern doctor at Tribhuvan University Teaching Hospital. Today, I am gonna talk about risk of bias assessment in systematic review. So, systematic review and meta-analysis, it is considered as one of the highest level of evidence in evidence-based medicine because they synthesize the finding from multiple studies to provide the comprehensive conclusion. However, the reliability of a systematic review it mainly depends on the quality of studies included. That is why we have to assess the bias in all the domain. There are certain domain in a randomized control trial, there are certain domain in a case report, there are certain domain in a observational study. So we have to access all the domains for the risk of bias assessment. So there is always possibility that the design, conduct or analysis of a study that can lead to the systematic error in the results. So risk of bias assessment plays an important role. It helps to determine whether the study results are trustworthy or distorted. The main outcome of the risk of bias assessment includes internal validity evaluation. RoB assessment it helps to evaluate the internal validity of the study. It identifies if there is any methodological weakness or not, which is very essential before pulling results in a meta-analysis. So without a risk of bias assessment, the systematic review or meta-analysis it may be misleading. Poor quality studies may be included, which may influence the pooled effect. The clinical recommendation it may be unreliable. So the benefits of RoB assessment it improves the credibility of the systematic review. It interprets if there is any heterogeneity in the study or not, and it guides if we can do subgroup analysis or systematic analysis or not. So let's learn about steps of the systematic review. There are certain steps. First of all, we do the literature research, we do screening of the title and abstract, we then do full text review. After the full text review, we uh, can assure how many studies can be included in the systematic review. So after finalizing the number of full text that can be included, we do risk of bias assessment, and then we can proceed to the data extraction and meta-analysis. So after screening full text, we should do risk of bias assessment. So there are different tools for the risk of bias assessment, and it mainly depends on the study type. For example, if you are including only RCTs in the systematic review, then you will follow Cochrane RoB2 tool. So I will show you the example of Cochrane RoB2 tool, and if there are only observational study, then you can use Robbins 1. So if your meta-analysis it has both RCT and observational studies, then for the RCT you will do Cochrane RoB2 tool, and for the observational you will use Robbins 1. Similarly, for the case report you will choose JVI appraisal checklist, and overall to check whether your systematic review is good or not, you will do it by Ambassador 2 checklist. So these all are the RoB tool that mainly differs according to the study type. So first of all you have to stratify your full text review based on the study type. Then you will have to use different RoB2 tools based on the study type. So for the randomized control trials, if your study has only randomized control trial, then we will check it on the mainly 5 domains. What are the 5 domains? You will have to check each RCT study based on if there is bias from the randomization process or not. Have the author used randomization process or not? Have the author used correct randomization step like computer generated sequence or it can be allotment process. So if there is bias from the randomization process or not, and you will judge each of the domain based on the three, like it can be low risk, it can be some concern, it can be high risk. Like if there is bias from the randomization, if the author haven't used the randomization in a randomized control trial, then it is a high risk. So, and another domain is bias due to deviation from the intended intervention, and another domain is bias due to missing outcome data, bias in outcome measurement, and bias in selection of the reported results. So you will judge all the three domain into the three categories: low risk, some concern, and high risk, and overall also you will judge. So I will show you the example. So this is the meta-analysis that we have published in 2024. It was rivaroxaban versus dalteparin in the treatment of cancer associated venous thromboembolism. So it consisted of different RCTs, like you can see Chowdhury et al., Agnelli et al., Kim et al., Lee JH et al., that is 2019 A and B, Chen et al. So based on this, like I have said, five domains. So based on five domains are D1, D2, D3, D4, and D5, and overall. So I have judged, and like for the high concern, it is cross red, and for the some concern, it is yellow minus, and for the low concern, it is plus green, and I have also classified into the no information as well. So this is a plot diagram that you can uh, draw through RoB's tool. So it is a different topic, so let's focus on this. So based on that, you will judge on each domain, like D1 of Chaudhary, D2, D3, D4, D5, and overall. So based on that, you will judge all the domain of the included studies. So for the case report, similarly, we have a different domains. For example, the domain number one is clear patient demographics, patient history, diagnostic method, intervention, adverse events, and follow-up outcomes. So we will judge if there is presence or not, or if there is unclear. So let's see the example. So this is a one of the systematic review that has been recently accepted by ENT-Sec journal. So it was written by me and Dr. Bigyan Gewali sir. So this study is transoral robotic surgery from the for laryngeal cleft type 1 to 3, a systematic review and the synthesis of technique, outcome, and safety. So basically, while doing the full text screening, we have found only 4 studies that have met the inclusion criteria, and maximum of the studies were case series, and a retrospective cohort study was also there. So we had used JBI critical appraisal for the case series and retrospective cohort studies. So we had judged based on the following domains, like if there was presence of inclusion criteria or not, diagnostic validity, if they have used the diagnostic validity or not, or consecutive inclusion or not, outcomes, if there the outcomes were clear or not, or confounder handling or not. So based on that, we have judged it yes, no, unclear, and based on that, overall quality was assessed as a low, moderate, low, moderate, and high. So in this way, we can do the RoB assessment of the retrospective cohort study or case series or RCTs as well that I have shown. So its impact is like based on the judgment, if the study is high risk, then it might overestimate the treatment effect. It can be in the odds ratio, it can be in the RR or OR, and high risk study, it may increase the heterogeneity and it may reduce the reliability of the pool estimates. So based on this, If there is high risk, then we can do sensitivity analysis, we can do subgroup analysis, or we can exclude the high risk studies. So key takeaway are: risk of bias is essential for the quality assessment. Different tools can be used for the different study designs and assessment. It must be done by the two independent reviewers. And visual plot, like you have seen here, it can be used to interpret the result of the RoB.